the national HIV/AIDS strategy is about sort of building capacity. And one of the things that was clear to us is how much there is needed in terms of capacity development, not just technical skills like grant writing or training of people, but also in terms of like really allowing those leadership platforms for professional development and human development to flourish, right? And that's, for me, really important way beyond HIV. As Latinos become one of the key electoral groups, one of the key demographic groups, one of the key marketing groups, it seems to me that we're going to need a much more diverse leadership. And one thing that I notice is that there's sort of, at times there's regional unevenness with that. So centers like New York that have had a long tradition of HIV prevention work, care, and treatment may have a lot more elaborated leadership structure and CBO structure than a place, let's say, in the Deep South or in the Midwest.
And in the same vein, I think that there's still the risk of people being burnt out, so that the leaders that are already existing are just so overextended that they're not able to really meet the needs in all the ways. So I think that part of it is really about developing a network of leaders that and where people can build on each other's strengths and learn from each other, but also be mentored through the process.
There was a challenge that was voiced from the health department angle in terms of how we can't find Latinos who want to be involved in our planning bodies. And oftentimes they cited, there's limited number of Latinos in their community that are interested. But then when we spoke with the focus group that was of the community angle, the community-based organizations that are a service provider, when we spoke to them about these various planning bodies and their involvement in them, oftentimes we heard, well, I didn't know about it. And if I knew about it, I was informed, I might apply. And so there's this disconnect.
The other thing is I'm always concerned in this work that there are all these wonderfully courageous and generous young, especially Latino gay men who are involved in this work who don't have bachelor's degrees. Who their first job is being a peer educator in an HIV prevention organization that's, let's say, Latino-led in one of the big cities. And they become full-time workers, but there's no real structure or incentive structure for them to go to school, to get tuition remission, to become professionals, because they really are professionals in effect. They just don't necessarily have the credentials behind them.
When we spoke to the health departments around kind of capacity and representation at their health department, I think, oftentimes, honestly, health departments realize, we don't have a lot of Latinos, and the ones that we do have at our health department are not at the senior level management level.
And it was clear to us that a lot of these community-based organizations were platforms for people to get skills, to get jobs, to get training. And so there was a lot of concern about really developing that workforce. One of the things that we came up with when we were sort of analyzing our data was there's a pent-up demand, right, for human development. And we found that sort of paradox where, in Latino-led organizations, people sort of, got some promotion, but there wasn't a lot of resources for that sort of development in terms of grant writing and other things. And in mainstream organizations, where non-Latino-led, people didn't get those promotions because they were seen as having certain linguistic and cultural skills that sort of, kept them in one place. I mean, there's that wonderful comment by one of our participants that says, I have 3 degrees, but it doesn't mean anything here because people want me to do this work which I do well, but I can't move forward. So it was, it was, like you say, opportunities and challenges.
It's a health disparity issue, right? I mean, right. I think the other part of it is really using frameworks that already exist and formulating coalitions and other collaborations that allow people to really work within like a health disparities framework, which is very much relevant as far as the National HIV/AIDS strategy. It's very much so. It's like making sure that the Latino organizations. So we have to think they're kind of the 2 types of organizations, but that the Latino organizations are equipped with that kind of language and with the skill sets available to think about and frame their work in that way. And the other part of it is that mainstream organizations take this work seriously in terms of thinking about it that way too, but really having the cultural competencies.
I think when you use the language of health disparities, you're really talking about this field, this social field that limits the possibilities of people's choices. And how do policymakers or people who are really interested in representing those stakeholders to policymakers like NASDAQ here in Washington, how do they create the programs or create the language or create the momentum to really address those structural deficits.